This is Ifeanyi Chukwu, a 5-year-old boy who had a swelling on the left side of the cheek.
Dr. Nkemakola Mokata just finished operating on little Ifeanyi Chukwu. More surgeries will be done today. It's going to be a busy day here. This is Unwana Health Center in Afikpo North, local government area of Ebonyi State. Mrs. Udumaga, a midwife, leads them in prayers to the Almighty God. Health talk follows.
Hypertension, they are taught diabetes.
It is a health talk on diabetes and hypertension, how to treat it and the prevention. I told them that when they eat excess carbohydrates, something like rice, gari, cassava, and the rest of them, if the glucose accumulates in the blood, the result is diabetes.
This crowd came with different illnesses.
The most prevalent of the diseases we see here, especially among senior citizens. But senior citizens are main people that are 60 years and above. Most of them will always come down with eye problem, short sight, long sight, glaucoma, and cataract, hypertension, diabetes, arthritis. We also have a handful of antenatal cases, pregnancy complications, cases of infertility, and then childhood illnesses.
Here are consultant doctors, experienced nurses, competent radiologists, and other qualified medical personnel. There are different departments like eye care, obstetrics, pediatric, pharmacy, radiological services, just to mention a few.
Glaucoma is prevalent in this community. It's a dangerous disease. We call it a silent killer. It can easily steal somebody's sight. But when it's discovered early, it can easily be taken care of.
And then we have a lot of patients with cataracts, both bilateral and unilateral. And they are all mature, which has led to loss of vision in the patients I've seen, especially the elderly patients. And then I've seen a lot of refractive error amongst the younger people.
We want to do an excision biopsy of a gluteal lipoma. We're actually doing it under local anesthesia, which we've already infiltrated. So patient is awake, but we're also monitoring her. It's actually a minor surgical procedure, but every surgery is major to us.
This is the ultrasound section and ECG section. We use ultrasound to check the internal soft tissue organs, check for pregnancy, the uterus, the abdominal structures, and some soft tissues as well. Then for ECG, we use it to check the physiology of the heart, a kind of survey.
This is laboratory section where we handle most of the routine tests. MP, which is malaria parasite test, WIDA test, which is test for typhoid. We do FOB, fecal occult blood. Looking at the staff here, they are all professionals in different fields in medical lab. Most of them majored in chemistry, some of them microbiology, some of them hematology, chemical pathology. So we have most of them in different areas. That's why we have come together as a team.
Onyeagala Nwanneya Welfare Association, the brain behind this program, started out as a women's group.
We had a visionary who is sadly late, and she thought that we should be agents of change in the community.
The women began with girl-child advocacy. Along the line, they included free medical outreach, and it was a huge success. Today, Onyeagala Nwanneya Welfare Association has both genders as members.
Every member of the group is an indigene of Unwana, but it's really spearheaded by a group of women who, by the mercies of God, are professionals in their own rights beyond the medical profession.
Every 27th and 28th December, indigenes of Unwana and nearby villages converge on this primary healthcare facility to receive top quality, all expenses paid medical care.
It's purely private, non-profit, and so far God has been amazing. We've also had in one of the editions where we actually took delivery of a set of twins. We want this to outlive us. So because of that, we have integrated the students under the auspices of the National Undergraduate Union for the community. We actually bring our children to come see what we do The essence is for us to be able to pass it on. We actually lost two of our very strong, and when I mean very strong, sponsors, and in this project, but that has not deterred us. One passed over 9 years ago, the other 6 years, and the only thing that has happened that it has only just gingered us to do more.
The members of Onyeagala Nwanneya Welfare Association and volunteers render selfless service to the community.
I don't joke with it. No matter how tight my schedule will be, I always make time to come and serve my community.
It's a humanitarian job. Whether they say thank you or not, we are doing it. We've decided to do it to help our people.
We are actually called volunteers. We have to organize our parents, our mothers and fathers precisely so that everything that we are doing here will be orderly carried out.
I derive joy in doing a selfless service to humanity.
Beneficiaries say only God can reward these good Nigerians.
I like it. I love what they are doing. I was very, very happy over the operation.
I encourage them to continue because God will pay them back.
This free medical outreach in Unwana has attracted the attention of the nation. Dr. Godia Ishaya, the president of the National Association of Resident Doctors of Nigeria, came to Unwana.
We came to partner with the organizer of this program that have been conducting such outreach on a yearly basis. Also give back to the community as we usually do in other parts of the country.
On this 13th edition, 1,225 patients were seen. 23 surgeries were done. There's a long goal.
To upgrade the facilities in this health center to a teaching hospital. And then the final phase will be where we will now need assistance of both government and international donor agencies to upgrade it to a tertiary health care facility where more complicated surgeries can be done.
Indeed, Onyeagala Nwanneya Welfare Association has once again put smiles on the faces of many through free medical consultations, free drugs, and free surgeries.